Right. Hello to anyone who is joining us. We will give it just a few moments for people to get online, and then we'll make a start. So we've got lots of questions to get through, haven't we, Tim, tonight?
Absolutely. Some excellent questions have come in. I'm sure there'll be more live as well.
Yes, absolutely. So yeah, good to see some people joining. This is always like the longest period while you're
Yeah, I know.
waiting for people to join. It's the longest minute.
Well, I think whilst
Um,
we're waiting, we should say we went to watch Joy last
mm,
night, didn't we? The premiere of a new film about the origins
yes.
of IVF. What did you think of it?
It was incredible. I actually popped a post on earlier on today. It's just the way they portrayed not just the kind of the stories of those who made it possible, but the women as well, I think that went through that process to test it before obviously it's become what it is today. So yeah, I would definitely recommend if anybody wants to watch Joy. I think it's on Netflix from next month, the end of next
Yes.
month, I believe. Brilliant film. And yeah, and Tim and I, let's make a start because we have got so many questions. I'm Becky Kearns, also known as Defining Mum, and through Paths to Parent Hub, we partner with Apricity to provide support and connection for donor conception. And I'm delighted to be joined by Dr. Tim Child. I can't call you just Tim, it's Dr. Tim, who you may have heard on the Big
Okay.
Fat Negative podcast and also from your own Insta lives that you've been doing, Tim. But just can you introduce yourself and obviously your new role
Yeah.
now with Apricity?
So I'm a Tim Child. I've been involved in IVF and fertility for nearly 30 years or so, so a very long time. I'm based in Oxford, so I have a University of Oxford position. I've been a consultant in Oxford for a number of years, but most recently, in fact, very recently this week, I joined Apricity as the Chief Medical Officer of Apricity. So I'm really excited about this new role and working with the excellent team at Apricity.
Fabulous. And we have got so many questions for you, Tim. So I'm going to start in a second. But just to say, for anybody who has joined, if you want to ask a question, I might just pop it either in the Q&A box or the chat, and I will keep an eye on those. There's also a few questions that I think have come in for me
Yeah.
as well, so we'll touch on those a little bit later. Um, just to start, Tim, can we through, I think for anybody who is coming to donor egg IVF, and that's what we're talking about tonight, what can they expect from that perspective of going through treatment as a recipient? Because it is different to going through an IVF cycle with your own eggs, isn't it?
That's right. So, I mean, in general, in case people don't know, I mean, traditionally when we talk about IVF, we're talking about a fresh IVF cycle. So it's a couple of weeks of stimulation to get the ovaries to hopefully build, grow some follicles, and then we do an egg collection. So that's the first 2 weeks of a fresh IVF cycle. People who are receiving donor eggs, medically, it is much more straightforward than a fresh IVF cycle, because if you're receiving donor eggs, you go through exactly the same treatment as a woman would do if she was going through a frozen cycle. So even if you might be being donated fresh or frozen eggs, and we'll come on to the differences, the actual drug treatment that you receive is the same. It's a frozen cycle. So basically what that involves is, let's make it even more confusing. There's two main ways of doing a frozen cycle. So you can either take some medications, and the main part of the medications is some estrogen, and you take estrogen tablets or patches to thicken up the womb lining, which is called the endometrium. So you take estrogen for a couple of weeks to thicken the lining up. We do some scans to make sure the lining has got nice and thick. We then add in some progesterone, so that's mimicking what happens in a natural cycle. So you're continuing with estrogen and the progesterone, and then during that time, we would then do an embryo transfer from the eggs that you've been donated, and obviously they would have to be fertilized with either donor or partner sperm. Alternatively, and that's called a medicated frozen cycle. So that's taking medications, taking drugs to get the endometrium prepared. Alternatively, for women who are having regular menstrual cycles, so if you are having regular menstrual cycles and your hormones are all fine, then we might do a natural cycle, and we would just time the transfer of the embryo back into your womb, based where you are in the cycle.
Yeah, so it is more straightforward from that
Mm.
perspective, isn't it?
It's more
And I
medically
suppose the
straight.
next
It's more medically straightforward. Obviously, there's lots of
medically,
other issues in terms, the counselling and the psychological side of it, but medically, it is much more straightforward. There's no risk of overstimulation of the ovaries because the ovaries are not
mm,
stimulated if you're receiving donor eggs. So there's no risk of OHSS. There's no risks of the egg collection. It is medically significantly
yeah.
more straightforward and safer.
I think actually, just from my own perspective, Tim, and I with others, and particularly those who are coming to this after POI, that getting the lining to be thick enough can sometimes be a challenge. Is that something that you come across, and what can be done to support the lining in
Yeah,
terms of?
yeah. So POI is premature ovarian insufficiency. So essentially, if the ovaries stop producing eggs earlier than expected, and that would be one of the reasons that we would offer
Mm,
donor eggs, but there'd be many other reasons as well, but that would be one of them. And so, no, I would agree. So certainly, to be fair, for most women, when we're looking at preparing the womb lining, even if they've not had, even if their period stopped some time ago, generally it's not an issue. We're looking to get the lining to about 7 or 8 millimeters. So it doesn't have to be
mm,
really thick. Once it's 7 or 8 millimeters, then that's fine for implantation. But you're quite right that some women, we will struggle to get the lining thicker. And that could be women who've had premature ovarian insufficiency. Some people call that, the old fashioned name for that is premature menopause. We also, I think, probably more often see that in women who maybe not gone through puberty themselves. So perhaps their
yeah.
ovaries never really got going and they didn't go through puberty. So they didn't have
Mm,
their own natural hormones growing in
mm,
the uterus, when they were a girl. And perhaps they were taken through puberty by having to receive some medications. So I think in my experience, that probably is the most difficult group
yeah.
where there can be an issue with thickening the lining. But again, just to reassure people, for most people, it's not an
Yeah.
issue.
Yeah, no, that's good to hear. And I suppose talking about donor eggs, one of the biggest questions is fresh donor eggs or frozen donor eggs. What
Yeah,
is the difference, and are the success rates different between the two? So, be good to
yeah.
understand a little bit more around that, in terms of your opinion and
Yeah, I mean, I guess
experience.
just starting off with sperm, which sounds a bit odd, but I mean, for anyone using donor sperm, it would, donor sperm has always been frozen sperm, and it's been frozen, and
Mm,
we've always used frozen donor sperm in clinics because for frozen sperm, the man who's donating the sperm has virology testing, so HIV and hepatitis before donating, and also a few months after donating as well to make sure that he hasn't become positive from one of the viruses during the period that he was donating. The other advantage of frozen sperm is that you can have that frozen sperm can be used on a day when you want to use it because it's just thawed out. So it doesn't matter, it
yeah.
fits in with your cycle. Now, for eggs, traditionally, donor eggs have been fresh eggs, but basically that's just because of technology. Because it's only relatively recently that the technology of freezing eggs has been as good as the technology of freezing sperm, and eggs are much more difficult to freeze than
Mm,
sperm. So until relatively recently, for donor eggs, they've had to be fresh because if you tried to freeze them, the success rates were very poor. So
yeah.
traditionally, and again, I think really probably until the last 5 years or so, um, anyone who was having donor eggs, sorry, receiving donor eggs, what would happen would be that you'd be matched with a donor. That donor would then go through a fresh IVF cycle, like I said at the beginning. So the 2 weeks of injections,
Mm,
another drug to stop her ovulating and losing the eggs, and then you as the recipient would have to be synchronized. So they're often called
yeah.
synchronized cycles. So you'd have to be taking drugs to go alongside her, but you'd be waiting to find out where she was
I
in her
remember that.
with the follicles. And so we'd be phoning the recipient saying, okay, well, your donor needs 2 more days. We've got to keep you in a holding pattern. And then we would do the egg collection. And then on the day of the egg collection, you then might find out how many eggs you've
Mm,
been donated. So you had to be synchronized. Very rarely, but it did sometimes happen, the donor perhaps wouldn't be able to donate either because maybe she didn't have enough follicles, or very occasionally the donor maybe changed her mind and decided not to donate. And we had a very difficult phone call with the recipient saying, I'm really sorry, but there are no fresh eggs to donate. So the whole holy grail really was moving away from that having to synchronize people and you be dependent
mm,
on the donor to a situation more like it is for donor sperm, where that egg donor would have been through IVF before, but rather than donating the eggs fresh, the mature eggs are all frozen. And then by freezing the eggs, the advantage of that is when you come through to receive the eggs, you're completely disconnected from where the donor is in her cycle. You know how many eggs are there. So whatever package you decide to go for, you know how many eggs you're getting. You're not waiting for a phone call.
Yeah.
And it just gives you as a recipient complete freedom to decide, well, if I want to wait one more month for my cycle because I've got a work or holiday thing, that's not a problem. You can just you can receive the donor eggs whenever you want.
Yeah, so it's practically easier to plan around and
Yeah.
less uncertain as well. And in terms of the thaw rates,
Yeah.
what would you say you're looking at
Yeah.
nowadays with the improved technology?
Yeah. So again, until 5 to 10, probably until 10 years ago, when we froze eggs, and this would be around the world, clinics would use a technique called slow freezing. So it took an hour or two to actually freeze the eggs, and the survival rate of thawing them maybe was 50% or so. And when they survived the thawing, they were okay, but they weren't great. And then this technique of vitrification, which is snap freezing, and nowadays it's how embryos and eggs are all vitrified in any any modern laboratory. So essentially, the eggs are plunged into liquid nitrogen and they're snap frozen, and that means that the main issue when we freeze eggs, because eggs are full of water, when you freeze eggs, and we all know that as water freezes, it expands as it turns into
Expands.
ice. The eggs can split if you don't do that freezing properly. So vitrification by snap freezing it, and there's various other compounds that are put into that mix. The survival rate when you then come to thaw it out is around about 80 to 90% or more. So again,
Yeah.
labs that are doing a good amount of egg freezing will be having survival rates of 85, 90, maybe even 95% survival rates.
Yeah, and the quality of eggs once they've been thawed, should there be any impact to the egg quality, Tim? Oh,
No, so
I don't know whether
when the eggs when eggs are thawed out, the it's a bit strange. It's dropping in and out a bit. But when eggs are thawed out and they survive the thawing, a thawed out frozen egg is exactly the same quality as a fresh egg. There's no difference at all with that.
yeah. No, that's good to know. I don't know whether I think sometimes connection can be a bit tricky, can't it, on with Wi-Fi, but just let me know if you can't hear me, Tim. We did have another question along the lines of frozen egg donation, around success rates with male factor infertility. Um, is there any kind of correlation? Would male factor infertility affect egg donation, especially with frozen eggs?
Let me see if I can. Yeah, I'm going to see if I can improve this signal here. Hold on. I'm not
No
sure if it's my
problem.
signal or your signal. Is that maybe fits in a bit now? I don't know.
I can hear you.
Let me just try this. Okay. Try.
Beauty of live webinars,
I know.
isn't
Let
it?
me try. Let's just see if that's better or not, but not sure where the issue is with it.
Yeah.
With yeah, so with the cause of the fertility issues, or whether it's male factor or whatever it might be, doesn't actually alter the success rate of using donor eggs or receiving donor eggs. So the big advantage of using donor eggs is that it really takes away any age factor that there might be from a female side, but also if it's male factor or tubal factor or anything else, it really doesn't matter, because with egg donation, what happens is the success rate of, if you're receiving donor eggs, the success rate is related to the age of the donor. So the age of the uterus doesn't affect the success rate of egg donation. So if someone is 45 years old and is thinking about having IVF with her own eggs at age 45, then the success rate is very low single figures with her own eggs at age 45. But with egg donation, the success rate is the same as the egg donors, and because egg donors in the UK are all 35 years old or less, and really below the age of 35, the success rate is very stable. You're looking at around about sort of 40% sort of live birth rate or more potentially per per cycle, even if the recipient is 40 years old, 45 years old, 50 years old.
Yeah, that's good to know. And then in terms of if there's male factor infertility, would something like ICSI be considered with donor eggs? What
Yeah.
considerations would you give around male factor?
Yeah, so when we use, so an important consideration is if we use fresh donor eggs, then for fresh donor eggs, um, whether conventional IVF, which is when the eggs and the sperm are mixed together, or ICSI is used, it just completely depends on the sperm quality in the same way as if you were just having normal IVF with your own eggs. If you're using frozen donor eggs, because the eggs have been frozen, when they're thawed out, you actually need to use ICSI. So for frozen donor eggs, ICSI is always used, and it's because the shell of the egg, it's called the zona pellucida, it sort of gets a bit harder, and so if you just try and do normal IVF, there's less of a chance of a sperm getting through into the egg. But again, just to reiterate, so for people with if there's a couple with male factor infertility, and you're using donor eggs, really, if they're frozen, we would use ICSI anyway. If you're having fresh donor eggs, then if the sperm quality was okay, we would do conventional. But if there's any question marks about it, we would do ICSI and inject the sperm into the eggs.
Yeah, thank you. And we've had a live question in actually around egg quality. Someone has asked, is there likely to be a significant difference in egg quality between a donor who is under 25 and a donor who is between 25 and 35? Obviously, it's quite individual, but it'd be interesting to hear
Yeah.
your thoughts.
No, there's not, because
That's
it's not, because the success rate is very, very stable, and the reason why the HFEA asked that donors in the UK are 35 years old or less is for a couple of reasons. It's for success rates. It's also because as people get into their later 30s, then there are increased risks of Down syndrome, etc. So some chromosomal abnormalities. But before up to the age of 35 or so, there's not any realistic increase. So someone 20 to 25 or 25 to 30, you're looking at the same success rate.
Yeah, that's good to know. Um, Somebody has also asked around what can somebody, so a recipient, do to increase their chances of getting pregnant with donor egg? And I think this is the thing you always want to know what's
Yeah.
within my control. What
Yeah.
can I do to improve those chances? Is there anything that you would suggest?
Well, I mean, I think really, I think whether someone is using donor eggs or their own eggs, or maybe a different part of the journey trying to get pregnant naturally, or using their frozen embryos from donor eggs, whatever it might be, really the basis of trying to maximize success rates in terms of what you can do yourself is the same with all of those situations. So I think from a donor egg perspective, I think it's preparing your body from a general health perspective. So certainly, keeping moving. So exercise is always good for general health. From a dietary point of view, it's a very hot topic at the moment, and when people often talk about the Mediterranean diet, and the reason why people talk about the Mediterranean diet is that it's full of antioxidants and all sorts of good vitamins and things like that. And a lot of people feel that you might not need to be taking lots of expensive supplements if you've got a good balanced Mediterranean type diet, because it's full of all these natural type supplements. But I think if people maybe aren't really sure about the dietary side of things or want to have some advice, there are some very good fertility focused dietitians out there that it might be worth discussing now. Anyone who is trying to get pregnant any woman should be taking folic acid and vitamin D. So certainly those two
Mhm.
things. And ideally, you're taking those for a few months before actually any fertility treatment. And I think the easiest way to take those sorts of things, folic acid and vitamin D, is just to buy something like Pregnacare Conception. I don't think you need to be going off spending lots of money on fancy supplements. Pregnacare Conception has got all the stuff in it. And if there's a male partner involved, I think the Well Man or the Test Him supplement, those sorts of things, I've got everything in there without you going off and spending lots of money on stuff. And just the last thing to say on that, in terms of preparing yourself, I think obviously we need to think about the psychological and the mental side of things as well. So all UK clinics are required by the HFEA to have an experienced fertility registered counsellor available for you. clinics will be expecting you to have seen a counsellor anyway for implications counselling if you're using any donor anything.
Mhm.
Um, but also just from a psychological support, then that maybe you need more than one session with a counsellor just to really help you be in the best place you can.
Absolutely. And I would say make the most of having that support. And I think we're obviously talking during this part of the webinar around that kind of practical going through it, but the psychological part is also so important. And we've just had a flurry of questions coming into the Q&A box. So I'm going to go through some of these, Tim, for people who are watching live. Um, so one attendee has asked, does egg donation help with complications that come with endometriosis? Um, from the perspective of obviously a condition that can be quite
Yeah,
difficult.
yeah. Yeah, so endometriosis is very common. About 20% of the general female population have endometriosis. And if you start looking at it from a fertility point of view, it's more than that. So it can cause pelvic pain. It can cause problems with getting pregnant, but in some people it causes no issues at all. So it's a really odd disease. From a fertility point of view, from an IVF point of view, um, from a donor egg, it's not really going to make any difference. So I think that if you have endometriosis and someone is talking to you about you maybe using donor eggs, perhaps because your own ovarian reserve has dropped down, maybe because of the endometriosis has affected the ovaries. Receiving donor eggs is not going to, the endometriosis is not going to affect the success rate of the donor egg. So I think whatever that success rate I mentioned beforehand, whether you've got endometriosis or not, because endometriosis is outside of the uterus, it doesn't affect what's going on inside the uterus, or if it does affect it, it's pretty minor. That's what the studies suggest.
Yeah, thank you. Um, Another question has come in around PCOS. So someone has said, I'm 46 and I've been diagnosed with PCOS. I'm considering IVF using donor eggs. How might PCOS affect my chances of success with egg donation? And are there any additional treatments or precautions I should take to improve my chances? So we've talked about endometriosis. It'd be
Yeah,
great to
yeah.
talk about PCOS, which is another quite common
Yeah, so
condition.
so I mean, so endometriosis, as I said, 20% plus of the population. PCOS isn't quite. PCOS is the common, so it's polycystic ovarian syndrome. It's the commonest hormonal condition in women. Probably about 5% of women have PCOS, and classically, it's irregular or absent periods. Ovaries that look polycystic on scan. Poly means lots of. Cystic is a really old-fashioned, out-of-date word for follicle. So it just meant lots of follicles on a scan. And the third thing is some women with PCOS will have hirsutism, which means excess body hair or acne or a raised testosterone level in a blood test. So if you have PCOS, then if you're having IVF with your own eggs, which I know that wasn't the question with PCOS, the thing we have to be very careful of is stimulating the ovaries, because PCOS patients can often over respond.
Mm.
But your situation in terms of the question, again, a bit like endometriosis, because everything is switched off during, if you, for most types of frozen cycles, as I said, we often use a medicated one where things are switched off. Your own hormones aren't really doing anything. And certainly for someone who's in their mid 40s, because we'd be concerned about your own hormones and whether they're really doing all the right things for a natural frozen cycle, I think we'd be looking almost certainly at suggesting a medicated frozen, giving you the estrogen and the progesterone just to be really sure that there's no gaps in hormones when we put that embryo back. In which case, your underlying PCOS really wouldn't matter, because we're switching things
Mm.
off that treatment. During pregnancy, women with PCOS are at increased risk of one of the complications of pregnancy, which is gestational diabetes, which is diabetes in pregnancy. So certainly anyone who's got a diagnosis of PCOS, I mean, during any pregnancy, they always look out for diabetes that develops during pregnancy, but having underlying PCOS would mean that they probably just need to look a bit more closely.
Yeah, that's great.
But
Thank you.
overall, the success rate were the same. So PCOS or endometriosis, or being aged 40, 45, 50 with egg donation, it's exactly the same success rate.
Yeah, because you're kind of removing the factor of the
Yeah.
impact on the eggs, aren't you?
Yes, that's right.
Yeah,
That's right.
yeah. We've also had a question around weight in
Mm.
egg donation. I know it's important for egg quality, but does having a higher BMI reduce success rates for egg donation transfers? Um,
Yeah, it does. There's been a lot of, so we know that it's always a difficult subject to discuss with people because obviously understandably weight understandably is often a long-term and sensitive issue. So it's difficult to discuss it, but it is important that from a doctor point of view we do discuss it so that people can make informed decisions about what they do from a treatment perspective. So we do know that as the BMI, and it's not a great measurement of weight. There are lots of criticisms of BMI, but the studies are often based on BMI. We know that as the BMI goes up, from a fertility point of view, the success rate, so the live birth rate, does go down. And there's often been question marks about why that might be. Is it egg quality? So it certainly might be. Egg quality might be part of it. But we do also know that as the BMI goes up, the miscarriage rate goes up. So there is a link between high BMI and an increase in miscarriage rate. The implantation rate of an embryo does also go down with increasing BMI. So yes, there is a link. Now, having said that, obviously there are lots of people with raised BMI who don't have any issues. So it's not a black or white thing that you can say above a certain BMI success won't happen. But there is a link. And just following on from what I said just now about problems during pregnancy, one of the big reasons why basically all clinics will have a maximum BMI that they will offer treatment to, whatever the type of treatment, is that during pregnancy, people with a high BMI, particularly if it's sort of above 35 and particularly above 40, the risk of gestational diabetes and high blood pressure in pregnancy, problems around the time of delivery, goes significantly higher. And so what we're trying to do when we talk about fertility treatment is to obviously get you pregnant, but that's only the first part of it. We want for you to have a healthy baby at the end of it all. And so optimizing BMI, perhaps with the help of a fertility nutritionist or dietitian, as we spoke about, absolutely will help increase the success rate.
Yeah, thank you, Tim. Um, we've had another question around acupuncture before going through donor egg IVF transfer. What were your thoughts around that? I know it
Yeah,
was something that I did do before. I think it was one of
yeah,
those moments of, oh, I can do this and I can control
yeah.
this. It's something I can
How
feel
did you
like I'm
find it?
doing.
What tell me about your experience?
You know what? It was the only time I've done it before and after a transfer. And to be honest, I think more for me, it was more of a psychological thing to feel like I was doing something that was actually quite calming, relaxing. But it was more of a, oh, I'd heard other people have done it. Let's just throw another thing in because I don't want to regret not doing it. And it's interesting to
Yeah,
hear what the
yeah.
actual kind of science is around it and whether there is any link.
Yeah, I mean, so within some areas, so obviously acupuncture has been around literally for a thousand. I'm actually a visiting professor of Chinese traditional medicine actually in Chengdu.
Really?
So yeah. So I spent some time over in China working over there in a TCM hospital, bizarrely. Anyway, so interestingly, in China they do not mix traditional Chinese medicine and Western medicine. So IVF, they don't mix them. So when I was working over there, and this was 10, 15 years ago, when I said, well, in the UK, often women will ask to have acupuncture alongside IVF, and the Chinese doctors looked at me a bit odd actually. So, well, okay, why is that? Because then often they would do one or the other. Because for women with PCOS who are trying to get pregnant naturally, there's really good evidence that things like acupuncture can help get ovulation going. So there are things that it can do. Absolutely. Now, within an IVF setting, my opinion, obviously, as a sort of mainly a Western trained doctor, is that the studies, I don't feel, when we look at them and put them all together, the studies don't show that if you have acupuncture, if you have 100 women having acupuncture
Mm.
and 100 women not having acupuncture, the live birth rate is essentially the same. Now, of course, acupuncturists will tell you different because they're coming from a different angle. But I think when we look scientifically at the studies that have been done, and there have been studies where 100 women have had acupuncture and 100 women have been randomized by a computer to not have acupuncture, the
Mm.
live birth rates are the same. But, and the really big thing here is if people feel better and more in control for having things like acupuncture or aromatherapy or reflexology or count or
Mm.
whatever it might be, that's a really important outcome. So people feeling in control, feeling stronger,
Mm.
psychologically stronger and better during it and less stress. Those are really important outcomes, even if I don't know that it results in a higher live birth rate, because that's one outcome. But obviously general well-being is a very important other outcome.
Yeah, and I think that is really important. I think from my own perspective of going from own egg IVF then into donor egg IVF, I suddenly felt very kind of left to twiddling my thumbs and I didn't feel as involved. And so it gave
Yeah,
me another
yeah,
focus that I can do this for myself and my mental well-being and to
yeah,
support myself. I think as opposed to when I was in my own egg cycle where you were very, very much involved at
yeah.
every point.
But just,
Um,
I mean, I'm not saying it definitely will not. Within science, you cannot say something definitely will or definitely
yeah.
won't help. Um, but I think the studies, when you put them all together, and there have been studies where people have had sham acupuncture. So half of the group have had proper acupuncture,
Mm,
and half have had sort of fake acupuncture where the needle's not been sharp and it's just been touched the skin. Because
yeah.
a lot of the queries about acupuncture are, well, if it helps, maybe it's because you've got someone spending an hour fussing over you. You know,
Yeah.
maybe
Yeah.
that's the big part of it.
Yeah.
Again, if you feel better for it, great, do it. But I've had some patients who hate acupuncture. They hate people fussing
Mm,
over them. They
yeah.
hate needles in them. And I said, well, don't do
Mm,
it then, because
yeah.
don't.
Yeah. Yeah, I wouldn't have it today. Like, it's not something I
Okay.
would go back to, but at the time, it kind of made me feel a bit more in control. Um, so we've had another question through around tests that women need to take before receiving a donor egg. This person has read some clinics look for mammograms, etc. What sort of tests would you look for ahead of
Yeah, okay.
recipient donor?
So in general, again, going back to what we spoke about at the beginning, that receiving donor eggs is basically like having a frozen cycle. So it would be the same as if someone froze their embryos 10 years before and then came back to use their own frozen embryos 10 years later. You'd have to be redoing tests because it's been 10 years, but basically it's the same for donor eggs. We're just from a clinic's point of view, we're just making sure that the uterus is normal. So we do an ultrasound scan to exclude the presence of any fibroids in the uterus or any polyps. We're checking the ovaries to make sure there's no ovarian cysts that need to be perhaps treated, and we're looking to see, is there a fluid collection in a fallopian tube, so a hydrosalpinx that maybe needs to be sorted. So there'll be a baseline ultrasound scan. We'll do some blood tests to check that your thyroid function is okay and that
Mm,
generally there's no underlying problems. We'll do probably a full blood count to make sure you're not anemic. And also, if we're looking at maybe freezing some embryos, because if you're receiving donor eggs and then they're being put with sperm and you're making embryos, and maybe we're looking at freezing some of those embryos, we also need to have HIV and hepatitis B and C testing as well.
yeah.
So there is some testing, and we do chlamydia and a few things, but it's not a lot of testing, in fact. Now, the mammogram has been mentioned because for women who perhaps are a bit further through their reproductive age, as people get into their 50s, that's when the UK mammogram screening service starts. It starts at the age of 50 now in the UK. So some clinics will say, well, at a certain age, and it will vary between clinics. So at Apricity, we've moved to age 50 for this. It used to be age 45, but clinics will have an age at which they may say, we would like you to have a mammogram just to confirm before we hopefully send you off
Yeah.
into pregnancy for 9 months and breastfeeding or what have you, just to confirm that there's no very early breast cancer there that
Mm,
should be picked up before pregnancy. It's not that we think the treatment is going to be causing breast problems.
mm.
It's just to, you obviously don't want to have a diagnosis like that during pregnancy. So some clinics, and like the American clinics, generally at age 45 will be asking for mammograms. In Spain, I think it's roughly 50 or so. And in the UK, it's probably between 45 and 50 for recipients.
No, that's really interesting. Thank you. I feel a bit like we're on mastermind and I'm just throwing these questions at you, Tim. It's your
Well, if I don't,
specialist
I mean, just
subject.
really, if I don't know an answer, I will, I'll say pass. So if I,
You've not passed any so far. The next question is around so
hopefully I'm
sticking with
answering
the
them right.
theme.
Yeah, we'll
You
see.
are. Well, I wouldn't know otherwise, but I it sounds correct. With genetic testing, when we're talking about donors, what testing do donors have to go through? Because that's also, I think, quite reassuring from a recipient perspective that certain conditions are tested for before um, you receive
Yeah.
the eggs.
Yeah, so the HFEA, which is the government agency that licenses all IVF, all clinics, but also all treatments, um, has a list of things that clinics are expected to test. Now, interestingly, in America, there's nothing. So which I only found that out today. Actually, I didn't realize that in America for egg donation there are no genetic tests or there's no testing at all that has to be done. Really, I mean, clinics will do it, but it's no requirement to do anything in
Mm.
particular. In the UK and in Spain, there's a list of things which have to be done. So what we do is we do infection screening for the donor to make sure, and the infection screening that a donor goes through is loads more than you would go through if you were using your own eggs for IVF. It's a
Yeah.
lot more in depth to look for any past history of different types of infections. Again, we wouldn't be testing another patient for. But in answer to the question, in terms of the genetic side of it, so we test for cystic fibrosis. So it's really, we're testing for things that are more common in that population, in that ethnic population.
Yeah.
So cystic fibrosis, because 1 in 20 of us are carriers for cystic
Mhm.
fibrosis, surprisingly common. We also do a karyotype, which is a genetic test to make sure there's no rearrangement of your chromosomes, so no translocation,
Mhm.
swapping around between chromosomes, because that can lead to issues. In certain ethnic groups, we will do thalassemia screening and sickle cell screening as
Yeah.
well. So there's really a panel of things. Now, what is not tested for is every possible really rare inherited condition, because that is just not possible. But that is why all clinics doing egg donation will take a very detailed family history of the donor.
Mhm.
And we work from Apricity, we work to a very long evidence-based list, which is published by the Scottish NHS, of a whole list of about 200 conditions. If a donor has any of those things there, then we would potentially decline them as a donor. And you might think, well, maybe the donor would lie. And I like to get asked that quite a lot. I guess why would someone lie would be one thing on that, because there's not really much of a benefit and the expenses they get for being a donor is pretty minimal. But also it's made very clear to donors that if they do lie or
Mhm.
they miss information out on any of these legal consent forms, there absolutely could be legal problems in the future. So they're made very aware of that.
Yeah. Yeah. And I think that is reassuring as well for those who are going
Yeah, of
down the
course.
route of using donor eggs. We've also had a question around off the topic of fresh versus frozen. Can we ask, can you tell us about epigenetics and the idea that a baby might take on some of the birth mother's characteristics?
Yeah.
And yeah, I've heard things around epigenetics. It'd be good to hear your thoughts around that, Tim.
Yes, it's so epi just means around. So epigenetics it's quite the last 10 years or so it's been spoken about quite a lot. So when if you have donation, whether it's egg or sperm or embryo donation, then so if with egg donation, the DNA in the nucleus is coming from the donor. So often the recipient will say, well, that's what this question is. The recipient will say, well, will there be any physical characteristics about a child that is coming from me as the recipient, even though obviously the DNA in the egg is what has made the egg side of that embryo that led to the child. So in terms of physical characteristics, in general, I'd say no, there wouldn't be. Now this whole epigenetics thing though is very interesting. So epigenetics is something where particularly how healthy you are during pregnancy. So if people are really unhealthy during pregnancy, so there's all sorts of things. So we know that people with an extremely poor diet during pregnancy and smoking and all sorts of things can actually affect their epigenetics. And what it does is within the cells of the embryo and the pregnancy of the
Mhm.
fetus, it actually affects how the DNA is read. So the DNA is
Mhm.
the same because you can't change the
Yeah.
DNA,
Yeah.
but it's almost like changing the magnifying glass of how the DNA is actually read from the page and how it's interpreted. And interestingly, once that epigenetics changes, it's changed forever in all of the people below that person.
Yeah.
So there's studies showing that the health of a grandparent actually will have effects on grandchildren and beyond. It stays there forever.
Yeah. Yeah, and epigenetics is fascinating, and I think it's
Yeah,
something we're learning more about. And I think sometimes you can look to epigenetics to try and find that comfort around genetic
yeah,
loss, I think,
yeah,
and
yeah,
I've heard that a lot. And there's a brilliant webinar over on Paths to Parent Hub with Dr. Helen O'Neill, who talks through
Yeah,
the concept of epigenetics. And it's almost like you're not going to change the DNA, but you can affect the way that it's expressed in other ways. And I think,
maximize it. You certainly
yeah,
by, so during pregnancy, so it's not that just during pregnancy, for that 9 months, it's not that there's
mm,
um, what it's not that whatever you do makes no difference to the long-term health of the baby. It absolutely does. So there really are things
yeah,
that that your health during that pregnancy can really optimize things um, in an epigenetic way that will that
mhm.
child will hand down to future generations as well.
Yeah, and I think this leads into one of the questions that came through before the webinar around the idea of nurture versus nature. And I mean, I always talk from my own personal perspective. I don't, we were just saying last night, actually, weren't we? You can't
Yeah,
ever define how much is nature versus nurture.
yeah,
Um, but I would say for me, as the girls have got older, I see more of the nurture in
mm,
them because it shapes who they are and how they act and their mannerisms and everything
yeah,
around it. And even people say that we look the same when we smile, and it's kind of mirroring
yeah,
facial expressions and things that it's really hard because it's not tangible in terms of you've
yeah,
not got my eyes in terms of the color or the shape or anything, but
yeah.
the way that we act and we spend time with them, they absorb that, and that's the
Yeah.
nurture. It'd be good to hear your thoughts around it, nature
I
versus
completely
nurture.
agree with you, and it's understandably it's something particularly people of course are unsure about. And so when I was as a doctor, if I'm having a discussion with someone who's really umming and ahhing about whether moving to donor is the right thing for them at that time or ever, and that's one of the things we might talk about. And I will and I always remember this. There was, and again, I told you this last night when we were talking, that there was a patient years ago, probably 15 years ago,
Mm.
who really ummed and ahed about the donation side of things, and she was really unsure about it. And obviously, it was a big decision. She took her time on the decision, had counselling, then did move over to egg donation, had
Mhm.
success. And I then I think I bumped into her somewhere like 5 years later or something. Oxford's a small place. So she sort of came up to me and said, "Oh, Tim," and there was this 5-year-old. And yeah, that even to my eyes looked like the mother. And she said, "Oh, it's amazing that our neighbours, who obviously don't know anything about the egg donation journey, just comment about how similar the girl is in terms of mannerisms." Because I'm talking now like that. You were moving your hands earlier on. These
Yeah,
are all things that
yeah,
that's the nurture side of it. And I've had so many patients who over the years who have really struggled with the decision to move on to donation. And then when I've seen them afterwards, maybe they've come back for to consider further donation after success, have sort of said um, that they're so aware of the nurture side of it and how important that is. And for them, it's not that the genetic side of it's not important now,
yeah,
but the importance of it has just gone down, down, down because in the end, obviously, the child is theirs. They carried it for nine
yeah,
months, and that
yeah.
nurture and the epigenetics and the nurture side afterwards.
And obviously, I think for those people who are listening tonight, who may be still at that very beginning stage of trying to get your head around whether this is even right for you, the genetics and the DNA side is the probably huge at the moment. And what does that mean? And I think it is only with time and acceptance and hearing stories and trying to work through some of those fears. And that's what within Paths to Parent Hub, which is offered to all Apricity recipients, there's a common fears resource where we talk about things such as fears around resemblance talk and how you can handle that. And it's all about supporting you so that you're in the best place to support your child. And I think these fears are so normal, they're so natural to
Yeah.
have. And I think it's so important that you talk about them because and get that counseling and psychological support as well.
Well, yeah, I almost think that if someone didn't even have any of those fears and didn't think about it, that would be
Yeah.
very unusual. Because I'd be thinking, well, I don't, it's
Yeah.
not. Maybe they haven't really thought through this, and so the implications counselling side that clinics offer is not there to turn people away from using donor. And I think some people are worried about that. Are they going to fail the counselling side?
Yeah.
It's not. That's not what it's for. It's for helping people. And if there's a couple being treated, are they on the same page with this? Obviously, the closer that people are being on the same page in terms of being sure it's the right thing for them at that time and how they're going to handle it in terms of at what point talking to any children or telling children
Yeah,
about their about where they've come from a donation perspective. That that for some people it's a short process. And again, I mentioned earlier on, I've had patients it's taken them 2 years to get to the point.
yeah,
The big advantage of donation is, as I said earlier on, your age in terms of receiving the eggs does not affect the success rate. So for people having fresh IVF, once past the mid 30s, there's always this understandable
yeah.
clock
Rush.
going the whole
Yeah,
time. And people sometimes, rushing into things because they're just so worried, understand about the time element. But for donor eggs, it does take that away, not completely, but significantly.
yeah, yeah. And I think just while we're on this topic, we have actually had somebody who sent a question in around, I'm still unsure whether I'm ready to give up on my eggs yet. And the term give up, I think, is a really difficult
It's
one because it
difficult,
is
isn't
making a choice to stop and try something different.
it? Yeah,
Um, but they said that their clinic uses an anonymous egg donor bank in Spain. I'm not sure how I feel about that. And husband and I are at odds about whether we should tell any child we may have. I
yeah,
would absolutely say have that counselling. And that is
yeah,
something that we didn't have because we went abroad and it wasn't part of what was offered. And so we didn't have that opportunity as a couple to talk through. And we always knew that we wanted to be open, but we didn't have a chance to really process the anonymity. And I think for those who've followed me for a while will know that I share my reflections around that. We went to the Czech Republic and now I've got the girls. That's the one thing I find really difficult, that I can't give them that choice to be able to find out their genetic origins at the age of 18. So I think it is something that if you can give that time and space to talk about it at that early stage, it's really important because these decisions will impact your future child as well.
yeah.
But from your perspective, Tim, I think there's a bit of a misconception that you have to wait really long waiting times in the UK for donor eggs, and actually I'm hearing more and more now that that isn't the case. That
Because of egg bank,
you,
so again, the reason, I mean, I've had so many of my patients over the years have gone to Spain or the States. A few have gone to Czech or Greece, but generally I've worked with clinics in Spain and the States, for 20 years, and it's a really good working relationship. But the only reason really to be flying across to somewhere else is to get access to get around that waiting list, and that's really why people would do it. The success rates are not better abroad. But the waiting list has been significantly shorter. So many clinics in the UK until recently would have had a 12-month, easily a 12-month plus waiting list for donor eggs, and that's why people go abroad. But the big change, going back to what we said at the beginning, was because we can now freeze eggs and build up more of an egg bank in the same way as clinics have a sperm donor bank, then it really brings the waiting times down. So I know at Apricity there are actually lots of frozen eggs available now. So there is not a waiting list. So people want to go to Spain. I mean, a big difference has been mentioned in the question, and what you've just said is that in the UK, the law is that this is the current law, at age 16, any any people can find out whether they were donor conceived, and when they're 18, they can get the name and the last known address of the donor. And in Spain, that is absolutely not the case. But I'm on the HFEA, so we're really sort of grappling with this at the moment with this home genetic testing stuff. So, sending a mouse swab off to ancestry.com or 23andMe. If that donor, maybe not her, but someone around her in her family has put their DNA on the website, you can triangulate
yeah,
in pretty quick. So
yeah,
and the whole anonymity thing in 2024,
yeah.
it sort of doesn't mean
Yeah.
anything really.
Yeah, and I would also say that if there's a question around, do I tell my children, don't I tell my children? I'm a huge advocate for open honesty,
Yeah.
and from my own experience, it's not an easy thing to do in terms of sharing what can be quite a difficult story, and there could be lots of fears around what does that mean and will they see me differently? But having heard stories of people who have found out later on in life, like you say, through DNA testing, which is so common these days. And feeling like maybe they've been lied to, I think that can be
Yeah.
a lot more damaging for
Well, that's
relationships.
really why. I mean, so the loss of anonymity thing really
Mm,
came in because of that, because of studies back
yeah.
in about 2005. I think the law changed, and it was really
Mm,
because of that, because of um, people really finding out, or feeling they really wanted to be able to trace the donor. A lot of it
yeah.
came from these sort of adoption type laws. Um, but it is a very personal decision, and and there's no right or wrong. And some people who receive donor, eggs or sperm, will decide not to say anything. Um, but I think that's a big decision to not say anything, because, as we said, people can find out, and home DNA testing has
Yeah.
blown the whole anonymity thing out of. Nothing is anonymous genetically with
No,
home testing.
anymore.
Nothing.
No. And but I've actually had a question through to say, have your kids always known Becky, or did you sit down and tell them? And it is really something that I don't think they will ever remember that moment of first being
Okay.
told, because we started, they're actually, and there is so much support out there now, I think, to help you with telling. And children's storybooks are a great way to go, and kind of was how I introduced that story to them. And they talk about how mummy's eggs were broken and we needed eggs from another lady. But I am mummy to them. There
Yeah.
is nobody else
Yeah.
that is mummy. And I think these sort of things again feel really big at the time when you're talking about a hypothetical child in the future that you don't know whether you're going to have, and you don't know that child or that relationship. But once you have that child, I think the process of bonding, and I almost think it is part of the bonding process, sharing with them this amazing story of the lengths you went to have them. But there is so much support. So I'd just say, if anybody's worried about that, don't, you're not on your own. There's those books that help almost give you a bit of a script to talk to them about. And children can take on so much.
Can they find
Mm,
out that information from from your platform then?
yes.
Yeah.
Yeah, so I mean, I share a lot on Defining Mum, my Instagram account around this, but also within Paths to Parent Hub, we've got sessions with child psychologists, with other people sharing different ways in which they've been talking to their children. So there is lots and lots of support there for you. So I don't want you to feel like you're on your own. I remember at first I felt like, how do I even talk about this?
Yeah.
And it has got easier over time, and I would say that as well. I think as you I think you grow more confident in your bond as your children get older, as well. Um, just conscious of time, so we've only got a few minutes left. But we have had another question around just around where to go for donor eggs. Do you have to get them through your IVF clinic? And I suppose this is something that at the time I was in my local clinic further north, didn't think to look elsewhere in the
Yeah.
UK. Um, and I suppose there are lots of options nowadays, aren't there, Tim? And I know Apricity have a number of options.
Yeah. I mean, I think it's so not all IVF clinics do egg donation, because it's particularly smaller clinics in some areas might not do it, because it's actually it's a lot of work to set up an egg donation program and an egg donation bank. So quite a few clinics may not offer egg donation, and they may, because of the waiting times, may then work with clinics abroad. And so, as mentioned earlier on, someone was obviously working with a clinic about going to Spain, and so some people will just contact a clinic in Spain and just do everything through that clinic, and will sort their own scans out in the UK. Other people will, their local IVF clinic will say, well, we'll refer you to Spain, and you have your scans with us, and it'll be a joint treatment thing. But it still involves all of that travel. So I think the big change, as I've said earlier, more recently, is that the availability of egg donor banks, and it's really just completely freed recipients up,
Mm,
having to be synchronized in with
yeah.
the donor. You also get more of a selection. So what happens if you go to Spain, for example? The law in Spain is that you, as the recipient, cannot choose your donor. That's the law. And
Mm,
what the doctor has to do is, the doctor legally in Spain has to make the decision about matching that donor to you. You have no say in it, because the doctor
yeah.
would get in trouble if they did. Whereas in the UK, that is not the situation. Traditionally, if you were doing the thing where you were waiting for a year and then the next donor comes up, the clinic may say to you, okay, these are the characteristics of the donor. And there's quite a lot of pressure on you then for yourself to say yes, because if you say no, you're then waiting for longer. And that's the downside of the old fashioned waiting for a fresh donor. Again, the advantage of the frozen egg bank is that there will be a number of eggs from different donors there with different physical characteristics. ethnic background, educational background. I've had one patient who was really keen on someone with a musical background. For her, that was really important. That going to a clinic with an egg donor bank,
Mhm.
it gives you
Yeah.
that choice, and in general, no waiting times, which definitely is the situation at Apricity.
Yeah, and it was very similar for me in the Czech Republic that the doctor did the matching, and I felt very kind of left out and was
Yeah,
desperate to know more and have that comfort that I was being matched in the way that I wanted to be matched. But I think the other benefit is I know with Apricity, you get lots of information, you get to get a real sense of who she is as a person as well. And I think kind of fast forwarding down the line now, having children to be able to share that sort of information around sort of why did she donate and what is she interested in and even just start spark up conversations around, oh, you're quite artistic. And actually, the donor
yeah,
was quite artistic as well. There might be certain things that
yeah.
are quite nice to have in the future as well around that. So,
And I
yeah.
think what we ask donors, we invite donors to write a sort of a pen note really of why, a bit about themselves, why are they donating, why are they giving this gift of life, and again that can then be passed on to
Yeah.
donor people in the future.
Yeah. Yeah, I'm going to try and do two more questions if I can. There's another one just come through. One that was pre-submitted is it recommended to do PGTA testing using donor eggs?
So the quick answer is no, because the eggs come from obviously a younger woman. There is no benefit of doing PGTA, which is genetic testing of embryos for numbers of chromosomes in egg donation patients.
Yeah, it's a good quick answer, so we can squeeze
Yeah.
one more question in. Um, Someone else has asked, going back to the question around frozen versus fresh donor eggs, considering the frozen egg may have to be frozen, defrosted, made into an embryo, then possibly frozen again, and finally defrosted for transfer, how much difference would you say there is in terms of survival rates compared to fresh eggs?
Yeah, I mean, so as I mentioned before, I mean now probably in any lab, certainly labs that we work with at Apricity that are doing a lot of egg freezing and egg thawing, it is a difficult procedure for the embryologist to do. But the survival rates are around about 90%, as I said. So they're very high survival rates. Once they survive thawing, they are the same as a fresh egg. And I think something to bear in mind is if you do fresh egg donation and you're being donated
Mm.
10 eggs in a fresh egg donation cycle, they're almost certainly not all mature. Some of them will be immature, probably 10 to 20% of them. So when we freeze donor eggs, we only freeze mature eggs. So we know that they are mature when they're frozen. We don't freeze immature eggs. Nearly all
Yeah.
of them survive. Once they survive, as I said, we then do ICSI on them. Generally, then when you then culture them through, if you're freezing them again as embryos, that doesn't matter because you're not thawing out an embryo and refreezing it. If the egg
Yeah.
survives the
Okay.
thawing, which again 90% do, then it's the same as a fresh egg. Freezing it as a blastocyst embryo in 5 days' time, it doesn't matter. It doesn't have any detrimental effect.
Yeah, it's fascinating talking about everything that's possible. Having watched the film last night about the
Yeah.
origins of IVF, thank you. And just the final question I'm going to come to before I wrap up. Another question from someone attending: are the egg donors required to release all their medical history? Are they going to complete a form which cannot be verified in the end? Is the question. I think we touched on this a little bit earlier around medical history.
Yeah, so there's a document that they do sign essentially consent forms, which are legal documents, just saying that what they've told us is legally, so
Mm.
it is correct, completely to their knowledge, and including their family history as well. So it's a very exhaustive set of questions that we go through. We in terms of occasionally what will happen, someone might say someone who has donated eggs in a few years time develops a condition or something like that. They are then asked to contact the clinic. The clinic would then look at that and see, well, is there any genetic link in this condition at all? And if there was, then potentially then the
Yeah.
recipient is contacted. But again, that's extremely unusual, because if anything, donors are more medically checked than people who are
Mm.
trying naturally, or who are using their own eggs.
Yeah.
They're through more genetic screening, more infection screening, more questions, more tests
Mhm.
than other people, for obvious reasons, to minimize risks. But it
Yeah.
does mean we turn away quite a few people, actually. So often we'll find an issue that the AMH might be too low, so we're worried about egg numbers, and or there's something else that's come up, we'll actually say, well, thank you very much for offering to donate, but no, because
Yeah.
in the end, we're very focused on the recipient and giving the recipient the best chance of success.
Yeah, absolutely. And I think the other way around, where maybe your child might develop something and you want to find out whether or not, I
Yeah.
think there is the option then to go back via the clinic to say, is it possible to contact the donor to find out about this? I know I did something like that early on, when
Yeah.
Lena developed something with her eyes. So I think it's not a complete dead end around being able
No,
to
definitely
find
not.
out.
So all donors are asked to sign a consent form saying that if in the future we needed to contact them to make sure, because it may, I know, say a child developed had some odd
Mm,
blood test result and the doctor was in the hospital saying, well, we think it's this. Just on the out chance, it would be really useful to know if the donor
yeah.
had this over there, because if they did have that, that might change it. So under those circumstances, we would go back to the donor and say, can you just confirm, since we
Mm,
saw you X years ago, has anything like this turned up? And obviously nearly always, no, it hasn't. And we then let the recipient know.
yeah. That's reassuring as well. Thank you so much, Tim.
Pleasure.
And
Very, very
thank you
good
to everyone
questions. Yeah.
who's joined. Yeah, some great questions and yeah, lots of engagement. So I hope you found it useful. Just to say, this session has been recorded. So I believe Apricity will be sending out an email later on this week with a link to the recording. Just to also say, I know we had a few questions around genetic loss, and we were focusing much more on the medical side of things today. There is a post on my Instagram that I shared a while ago, which is pinned to the top around genetic loss, and there is lots of support from a perinatal psychologist, Julianne, within Paths to Parent Hub. There's also the Paths to Parent Hub podcast, if you've not listened to that, with lots of information, story sharing. And there is, I think we've got 1 or 2 tickets left for our event on the 2nd of November, which Christy is sponsoring, where there's going to be a room full of people who are at the same stage at the beginning of making the decision, maybe going through treatment. We've got panels of parents, donor conceived people, and professionals talking about how we support ourselves psychologically through this. So just another opportunity to get that support. But yeah, thank you so much, Tim. I don't know if there's anything you want to add before we go.
No, very good questions, and again, I think please just contact the clinic for any questions that you've got and any concerns, and we have counsellors available as necessary. And I'm going to find it. I'm doing a live tomorrow night as well at 7 o'clock. So if you ask questions that I didn't get around to answering, then please come on tomorrow at 7 o'clock on Dr. Tim Child on Instagram.
Yes, fabulous. So very busy man, Tim. And
Not at all.
live every night. Thank you so much, and thanks everyone for attending. And yeah, we will be back soon. And yeah, have a good rest of your evening.
Okay. Evening,
Take
Becky.
care.